Mhm.
Good evening. My name is Jocelyn Turner. I am the REACH Initiative Director for the Partnership for Child Health. Thank you for joining us all tonight. We have a robust group of speakers. I believe you will gain some insight if you have some underlying questions or questions that have not been answered throughout this pandemic. I am pleased to invite you to hear from the following speakers tonight: Dr. John Montgomery, Dr. Kenyatta Lee, Pastor Tony Walton, Dr. Andrea Hart, and Miss Mia Hobdy. Pardon me, Miss Hobdy. Again, we're going to have some questions of our panelists. If you have any questions throughout, please indicate them in the question and answer box or in the chat, whichever is showing up on your computer. Thank you again for joining us. We're going to go ahead and get started. I'd like to introduce to you Dr. John Montgomery. Dr. Montgomery is the lead market medical officer for Humana. He is the past president of the Duval County Medical Society, past chief epidemiologist and director of health services for the Duval County Health Department. Good evening, Dr. Montgomery. The floor is yours.
Good evening, Jocelyn, and thank you all for taking of your time this evening to join us. And thank you to my fellow panelists as well. We're really excited about the opportunity to be before you this evening because it's really important for us personally and professionally. For me, it's personal. I've been involved in the forefront of trying to protect the health and well-being of the citizens of Jacksonville since 1990. That's a long time. I was a former epidemiologist and wrote an article back in 1990 about immunizations for the Jacksonville Medical Journal and about how important it was back then. And so we're here today with my fellow colleagues, and we're going to talk to you about something that's even more important as we see the emergence of, and the ongoing emergence of an ongoing pandemic. And in this pandemic, what's it doing? It's infecting and impacting our communities. And so you're going to have an opportunity to hear from a number of us this evening about why we believe as clinicians, as providers and other leaders within your community, how important it is that you all join with us and so many others to help protect our communities and one another against this incredible disease that's continuing to change right before our very eyes. So you're going to hear from me, you're going to hear from others, we're going to answer your questions, but most importantly, this is a time for you to learn and for you to look out among yourselves and see trusted partners, see individuals who have been in the trenches and know that we want you to trust us. I oftentimes say to individuals, you're going to trust us, myself, Dr. Lee and others, if you get sick and you come into that emergency room, you're going to trust us in that intensive care unit to take care of you if you get COVID. What we're asking you now is to trust us as we give you that vaccine, as you help us prevent you from getting that infectious disease, right? So if you're going to trust us to treat you when you get really sick, all I ask now is that you trust us to prevent you from getting really sick. I did emergency room medicine. I know what it's like when someone comes in and they can't breathe and I have to intubate them. And you would trust me, and people do that all the time, trusting our colleagues in the healthcare environment. What we're asking you to do now is to trust us as we want to get that vaccine in your arm and prevent you and others from being impacted by what we see as a very deadly and challenging disease impacting our community, our country, our nation, and our world. And so, Jocelyn, I'm going to turn it back over to you and let you go ahead and introduce several of our other colleagues as we continue on this evening. Thank you.
Thank you, Dr. Montgomery, for your insight, and we will hear more from you shortly as we begin the Q&A segment of our webinar tonight. I'd like to introduce you now to Dr. Kenyatta Lee. Dr. Lee is the president of the Northeast Florida Medical Society, CEO of Pareto Population Health Management Practice. Good evening, Dr. Lee. The mic is yours. Unmute, Dr. Lee.
Good evening, and thank you for having me. I'm excited to be here amongst my colleagues to discuss this issue. As we know that this has been a catastrophe of major proportions within our communities, and its impact on humanity across the board has been incredibly devastating. What we also know is that there is a disproportionate impact that this pandemic has had on communities, particularly of color. And so part of our discussion today, I certainly am committed to this human impact that this has had, but I'm also wanting to focus on the fact that we know that within the African American community that we're more than 2.8 times more likely to die from COVID than any other group. This is significant. This is a problem. We know that we have life-saving vaccines that make a difference, and we have the resources to actually use those in other modalities that make a huge difference in how we can actually improve the outcomes within our community. So today, thank you for joining us. I look forward to having a discussion, and I certainly want to make sure that we remember just what's happening and how this epidemic is affecting different populations within our country disproportionately.
Thank you, Dr. Lee. Now I'd like to introduce you to Pastor Tony Walton. Pastor Walton is the pastor of Harmony Church of Jacksonville. He is a COVID survivor. He's a licensed funeral director and a restorative artist, if you know what that means. And I think some of you might. Pastor Walton, the mic is yours.
Good evening. I'm here this evening as a pastor and as a funeral director because I bring to you over 40 years experience in the funeral industry, and never have I ever seen a disease have an impact upon the world as COVID, and it's totally preventable. And so I'm here this evening because I don't want any of you to have to come see me in my profession when it's not necessary. And you must understand the importance of this vaccine, not only must you understand, but make sure and tell your family, because this is preventable at this time. And so I just like to say once again, never have I seen anything affect the world or the industry as COVID-19. And again, I say again, it is preventable if you get the vaccine. Jocelyn, it's back to you.
Thank you, Pastor Walton. And at this time, I would like to ask, you know what? I need to first pause a moment. I skipped someone, and I have to apologize to Ms. Hobdy, but I'm going to come back to her after Dr. Hart speak. Dr. Hart is the CEO of Agape Life Solutions. Dr. Hart, the floor is yours.
Hello, everyone. Thank you guys for joining us. I appreciate you, Jocelyn, for putting this together, and your team and all my other esteemed colleagues. And I'm coming from an assortment of backgrounds. Currently, I do have a consulting agency in and around health and healing on the faith-based realm, but also have spent 20 years in health promotion, health education, and currently work at I'm on the pastoral staff of one of the largest churches in Jacksonville. We run about 3,000 on Sundays, and I'm just here to really speak to individuals in around when they're in and around and they're looking through the lenses of their faith. And is this something that I need to get as a person of faith? Things that I have seen, our church had national attention when we had about 7 members die within 2 weeks. And it might seem like a good soundbite to some individuals. It'll be catchy and get story. But for us, we are in the trenches in that we're doing more funerals in the last probably 2 weeks than we've done in 10 years. So we're seeing that, and we're having to minister to families in ways that we never thought we would ever have to do. So I just appreciate everyone for being here, listening to us, and hopefully you will be able to take some of the things that we've said and speak to other individuals in the community as well.
Thank you, Dr. Hart. And I am going to back up because I missed Ms. Hobdy. Ms. Hobdy will now share with you why we're doing this program tonight and bring you greetings from our opening remarks from Edward Waters University, as she is the executive director of Newtown Success Zone. Ms. Hobdy, the floor is yours.
Thank you, Jocelyn. Good afternoon. Good evening, everyone. Thank you so much for being here. We are, as Jocelyn mentioned, I'm the executive director of the Newtown Success Zone, and I come to you also representing the Shell Suite Center over on the campus of Edward Waters University. The two centers Newtown Success Zone and Shell Suite work in the community to engage residents in and around the Kings Road area where the university is located. We work to bring resources and services to a community that is considered fragile. There are many resources needed in this community. It is Health Zone 1, some of the most, I would say, probably in the city. We have some very serious health issues in the Newtown and Kings Road area. 32209 is the zip code. And we have been working, Shell Suite and Newtown Success Zone, we've been working in the community at the very start of COVID. We worked to bring meals to the community at the very beginning of the COVID, the start of COVID, when the stay-at-home orders were issued. We got 5,000 to 6,000 masks out into the community when masks were hard to come by. It's probably hard to remember that, but masks were hard to come by at some point. So we were able to get thousands of masks out into the community when there really weren't any out there, and just to address the needs of a community that in a lot of ways likely felt abandoned. Now, this was all prior to a vaccine being entered onto the scene in this fight against COVID. And now that we have these other options, the solutions to help ameliorate this awful, awful virus, we feel it's our job to bring the information and the resources to the community. And we know that there are some folks who are hesitant in the community about getting the COVID vaccine. So we would like to just play a part in bringing whatever information we can to the community. And that's why we're here tonight. And we are very much excited about all of you who have joined us tonight, and hope that you will ask any questions that you may have so that those questions can be answered. And we will be hosting on this coming Saturday, the 28th, as a follow-up to this process. We will be hosting an event. It is a drive-through grocery event, but we will also have COVID vaccine shots and COVID testing available on site at 1401 Grunthal Street. I'll mention that again at the end, but we will have COVID testing and COVID vaccinations on site at 1401 Grunthal Street on the campus of Edward Waters University on this coming Saturday, August 28th. Thank you, Jocelyn.
Thank you, Ms. Hobdy. And so now we will begin our questioning of our panelists. I would like to start the question by asking Dr. Montgomery, how have you been personally or professionally impacted by COVID-19?
Oh, thank you, Jocelyn, for that question. And it's interesting for me, professionally, wow. Folks, I wrote an article and I was the chief epidemiologist and ran health departments here in the city. And I remember being the director of the health department in Volusia County when we had our first SARS case. So back in April of 2004, I was writing about this SARS virus. So for me as an infectious disease epidemiologist, personally, it's longstanding. For me as someone who was responsible for managing public health diseases and outbreaks after 9/11, this is personal, right? Because since I've been in this community since 1989, my whole effort and my work has always been to protect the health and well-being of the citizens of Jacksonville, and the record and the work and everything is there. So that's why, to me, his comment about why we're here today, this is major, this is important. In all my years, I've not seen anything this bad. And who's it infecting? Neighbors, friends, family members, everyone. You heard, Dr. Hart mentioned church members. It is infecting physicians. I was involved at the very beginning when, and I appreciate Humana and all of us for coming together collectively to help put this on. But I mean, I remember at the very first time when we've had our first case, and I was involved from the very beginning in identifying a physician who had contracted this disease. And knowing the epidemiology like I do as someone who studied viruses, it's very alarming and very concerning. And so we can only thank everybody for collectively coming together, because folks, in my years, we haven't come collectively together like this to inform you all that this virus is impacting all of us professionally, physician colleagues, friends, loved ones. It's nonstop. And why? Because it's an infectious disease. And I used to always say, when I was training at Yale, if you have a chronic disease and you stand next to me with heart disease, I'm not going to get heart disease from you, or I'm not going to get cancer from you. And I respectfully say, I was the past chair of the board of the American Cancer Society. But if you got an infectious disease and I stand next to you, the potential is that I can give you that infectious disease. And not only can I give it to you, I can kill you from that infectious disease. And not only can I give it to you and kill you, I can give it to multiple other members. And then what else? You can give it to multiple other people and infect them and kill them. See the magnitude? 1 infects 5, 10, and then 10 infects so many more. And to Dr. Lee's comments, so poignant, right? It's impacting our community. We're not surprised. It's impacting everyone. So when it impacts everyone, you know the profound effect and the doubling or tripling or quadrupling effect it's going to have in our community. And that's why we're here, to talk to you all, to answer your questions, to get you out to the event, but most importantly, to get you vaccinated. So personally and professionally, Jocelyn, that's how I sum it up in terms of how this disease has impacted me. Every single day, this is not even my real job in my role, but every single day, my public health in me has been involved in protecting the people of the city of Jacksonville.
Yeah, thank you, Dr. Montgomery. And it prompted me to interject something at this point that I didn't mention to folks about me. And that is, I retired a couple of years ago from the Florida Department of Health. And quite frankly, the pandemic brought me out of retirement. I couldn't sit back and just watch folks get sick and die without not interjecting some of my expertise and all that I've learned at the health department. So I'm thankful for Humana. I'm thankful for Edward Waters University and the Newtown Success Zone. I'm thankful for Pastor Walton and Dr. Hart and all of you for participating tonight. Dr. Lee, now I'd like to ask you the question as well. How have you been personally or professionally impacted by COVID-19?
You know, the first thought we started our practice, Pareto Clinic, and when you do a business plan, you account for variances. You assume that things could happen, could go wrong. And we thought about hurricanes and tornadoes and a flood, maybe some locusts even, but we could have never imagined in a million years that the entire country would have been shut down the way that it was and has been. And certainly early on when COVID first presented itself, it was amazingly devastating. You saw primary care shift. You have different levels of healthcare workers, but early on in the pandemic, we didn't know we had an idea what it was, but we didn't know how to treat it. The infection prevention strategies that have become sort of commonplace, the mask, the wiping, the cleaning, the filtration systems that we use to clean it, that was something we had never thought of doing, but that was an integral part of what we had to do professionally. One of the things I thought about was this idea was we were seeing patients. Not only did we open the practice, we built the practice and we grew the practice in the middle of the pandemic, in spite of the pandemic. And in some ways, because of the pandemic, because we saw that there was a need to make that happen. There was a real sort of mortality moment where we sort of dealt with I didn't want to die, and I knew that by seeing patients, I could die. But I knew that this was something that we had to do. And this is what we did. So for me, professionally, that was significant. The last piece to that is what I'm seeing this do to our patients. It's painful. It's painful because we're seeing people who were perfectly healthy, strong, strapping, strong as a horse, kick a tree, knock it down kind of men who are now on oxygen, 4 liters, satting at 92%. That's what we're seeing. People who couldn't have imagined that this could have happened to them, and actually seeing that devastating, seeing them being affected by it, seeing the isolation that affects our seniors, which is tremendous, and also recognizing the impact that the death is having on them as their family members begin to die. The sadness, the alcohol, that whole dynamic has affected me tremendously professionally. So it's been pretty significant. Thank you for the question.
Thank you, Dr. Lee. And I can only imagine how you've been dealing with it, quite frankly, in your practice. Pastor Walton, same question. How have you been personally or professionally impacted by COVID-19?
Personally, by contracting COVID. I contracted COVID, my wife and my sister-in-law. My wife and my sister-in-law, or sister-in-law, as some refer to them, they were hospitalized. I was asymptomatic. So when Dr. was speaking of somebody who can have it and can pass it to someone else, it's just remarkable because, as I stated earlier, I started in the funeral industry when I was very young. And when I began in the industry, the only thing we really had to worry about was tuberculosis. That was the most threatening thing at that time. I saw AIDS come around, the swine flu, the bird flu, MRSA. And I've seen these various diseases evolve over the years, and never before have I ever seen anything to have an impact upon the industry like this. I was part of the beginning of the funeral service program at Florida State College. I taught embalming and restorative art for 10 years. And I used to tell my students all the time, disease have no bearing upon your race, upon your status, your education. It doesn't matter. The disease can come upon you in anything. And the one thing that I had to get them to understand above all is that embalming fluid is universal. There's not a particular embalming fluid that you need for a particular race of people. You can use one embalming fluid upon everybody. And I want us to understand that this particular disease never has anything affected the funeral industry. During the Great Depression didn't have a bearing upon the funeral industry like COVID-19 does, and the variant, the Delta variant that's coming around. And you'll find that never before has people said you can only have in the church. I've been in the church my entire life, and I'm 57 years old. I've been a pastor now for about 28 years. And never before have I heard someone say, we can only have 50 people in church, or you can only have this many people at a service. And it's what I say, this is totally preventable. I've had vaccines of hepatitis B, and I've received 3 different doses, and ever so often we have to receive booster shots from this. So all of the things that people are saying concerning this particular vaccine, we're telling you it's not new. These are things that we have to do in order to be able to survive. And again, this is totally preventable. And another thing is, if you have any underlying health condition, this vaccine, this particular disease will bring it out. I was diagnosed last year with stage 4 lung cancer. And now, but that because of medicine, prayer, and faith, because I love the scripture that says, I'll show you, you show me your faith without works, and I'll show you my faith by my works. And I want us to understand that the scripture totally supports medicine. It supports getting this vaccine because these things are preventable. And I received an article the other day that says, would Jesus wear a mask? And I'm telling you, yeah, he would wear a mask. He died for our sins. He died to reconcile us back to God. And I'm sure he wouldn't have a problem wearing a mask for us. And the thing we must realize is no greater love, no greater gift can we give to people we love than the gift of getting this vaccine and taking care of ourselves, that they can take care of themselves. And the last thing I'd like to say is, it has really impacted my family personally. On Saturday, I had a 17-year-old grandniece in Lake City, Florida. They had her service because of COVID. I talked to a funeral home the other day, and they had 13 cases in there. 12 of them died of COVID. I talked to a funeral home in Gainesville, Florida, around the state. And if you can understand, it's not just elderly people that's getting this. It's young people that's getting this. And the one thing that everybody has in common is they haven't been vaccinated. So I'm here tonight because I want you guys to realize it's preventable.
Thank you, Pastor Walton. That was very impassioned. I really appreciate it. And for the scriptural reference.
Oh, that was in James chapter 2, verse 18.
Thank you.
James chapter 2, verse 18.
Thank you, Pastor Walton. Dr. Hart, how have you been personally or professionally impacted by COVID-19? And you shared a little bit at the beginning of as you were introducing yourself. Would you like to expound on that, please?
Sure. Well, it's just been a really, really tough season for myself, working very closely in a very, very large church. And I'll start with personally. Personally, when we first started when we heard about the pandemic, it hurt. It hit home for me because my husband is immunocompromised. He had a double transplant. He had a kidney pancreas transplant about 7 years ago. So and everything's going well. But when I heard about the pandemic, that automatically strikes fear in your heart because he's so much of the vulnerable population. And thank God he has not been positive for COVID during this whole time. And he actually just got his third shot today. So I thank God for that. But personally, and then my sister's a medical doctor in Michigan, and just seeing the stress that she goes through and has gone through treating those patients. She services a homeless type population there, underserved population there of primarily probably 99% African American individuals. From that, seeing how she's literally exhausted. She's internal medicine and primary care, so literally exhausted during the whole pandemic, so that hit me there as well. And then having to go to where I do most of my work here at our church, Impact Church here in Jacksonville, Florida, dealing with the mental health and the emotional health of individuals that are dealing with people. We get pastoral care reports once a week. And early in the pandemic, around March and April, it seemed as though that report was full of individuals that have either themselves or family members that are dealing with COVID positive in the hospital, all these things. And then it slowed down. And then here recently, being in the epicenter here in Florida, it took a turn for the worse, where we were having multiple calls, having to deal with families positive, staff members positive, and it's individuals that have been vaccinated and not vaccinated. But the deaths that we've had within, like I told you, we had 7 within 10 days, and then we had another person after that, so 8 within 2 weeks to pass away. Dealing with that and the families and having the multiple homegoings, to the point it's almost like you have to get on a schedule because it's booked up at the church, and we're in a very, very large church, and it's booked up to get the sanctuary to have a homegoing where that we have never seen things like that. So it's just been a lot for those that are in those types of service, being a service professional in that realm, and then dealing with the misinformation. Our pastor, George Davis, he's been very vocal, as it were, when it comes to just speaking on and dispelling the misinformation in the context of faith when it comes across and individuals are saying why they don't want to be vaccinated. We went ahead and I think we're having our next vaccination event this Sunday, but we've had multiple vaccination events, and he's been in the forefront, being a trusted voice to get individuals, and within our church, younger people. Our church is about 80% African American, 20% other. So getting young people to have an understanding, those that think they are impenetrable of anything. And then even in our church, the ones that passed away, 4 of those individuals were under 35. So dealing with all these things, the bereavement issues, it's just been quite a bit. Thank God that we do know God so that we can lean and depend on him. But we all need to be cognizant that it doesn't just affect the doctors. It doesn't just affect the individual patients, that it's a continuum, that there's so many people that are touched by this. And then even today, I heard of a lady immunocompromised, fully vaccinated, but had a breakthrough case. So she's in ICU, 70 or something years old, and having to, wrestle with that, deal with that, pray with that, talk to family and loved ones when they've done what they thought they should have done, is gotten vaccinated. But you have individuals that are out there that for whatever reason have not gotten vaccinated, and she came across one of those individuals and tested COVID positive. So I see it from all spaces and realms. And I just am so happy that we're having this platform and this conversation, because there is a lot of misinformation out there. And the more trusted voices that are around and here to speak from lived experiences that they've had as a patient, as a doctor from all different sides. I think that really helps individuals, because at this point, I think individuals that are non-mask wearers, anti-vax, and all these things, I don't know that they've been touched by the virus personally. So it's easy to have a soundbite or say something that they've heard or repeat something they've heard on social media and be just very casual in how they're treating this, because right now is the virus is spiking across the country. So if you have not been touched by it in one way or the other, you will. 100% of the time you will. So hopefully and prayerfully through this conversation, we can help some people be able to speak to other individuals that give them a bunch of because I've heard a lot of different misinformation, and be able to speak coherently and being able to be compassionate and be able to even listen to their fears, address them with concrete facts, and just kind of walk with them to be able to get vaccinated or to get closer to just taking the precautions necessary so that they can be safe.
Thank you, Dr. Hart. I really appreciate that. Dr. Lee, I'm going to pose the next question to you. And thank you all for posting questions in the chat and the Q&A box. We will get to your questions shortly. Dr. Lee, why are people who have no physical issues dying from COVID-19?
That's such a good question. When you think about it, what you have is the probability of a thing. You're more likely to live if you have a seatbelt on, but there's no 100%. If you're driving a vehicle that gets into a car accident, you're more likely with a seatbelt to survive that accident than if you did not. When you see people that get ill, who have COVID, what we're saying is that your probability of complications is greater if you have diabetes, or if you're immunocompromised, if you have cancer, if you have kidney disease. That increases your probability, but it doesn't mean that your risk is absolutely zero. So when you look at COVID, it is the perfect storm. Remember, they used to talk about El Nino. My Spanish is not good, but it was all about something warming and the storm and the wind and how rotational thing of the earth and all this amazing stuff that would happen to create these perfect storms. When you look at this virus, it's an RNA virus. It's what's called a zoonotic virus that comes from an animal source. And this virus, of course, is really aggressive in terms of its impact on the body. So if you're sick, you're sick. And if you're healthy and you get sick, the probability, it's possible, and it's more likely than not, that 80% of the people that are not in that high risk group will do just fine. But that population of people who get it, have this illness, anything can happen. The virus affects almost every system. Of course, it causes respiratory failure, so the lungs are involved in exchanging oxygen so that you can breathe. But it also affects your heart. It can cause arrhythmias, atrial fibrillation. It can cause heart attacks. It affects your clotting systems within your body. It can actually cause what's called a PE, or a blood clot, which actually could kill you as well. It can cause an immune cascade within your body where your body is essentially on fire. And there's a release of hormones and proteins that just cause fever and complications that affects all those things. Even if you're otherwise healthy, these things can happen to you and you can die. Now, this is, of course, the rarity. We know that the majority of the people who get this virus have severe or critically ill complications because of this are going to be older. They're going to have some other comorbid issue. But the reality is that this can happen to anyone. I think, and that's a humbling fact. People have used that as a reason to say, well, a person was vaccinated, so I shouldn't get, and they got it, so why should I get vaccinated? The facts don't stick with that. We know that there was a study that looked at over 107,000 individuals. Within that population, 1,200 of them were fully vaccinated, or about 1% of them that actually got hospitalized. What that tells you is that the majority of the people who have complications from this issue are going to be people who are unvaccinated. And in most instances, it's going to be people with some sort of comorbid complication. So it is, you can be healthy as a horse, and I'm assuming most horses are healthy. And I've seen my patients, healthy, young and healthy, end up with this. And even the mortality, we use the two words, mortality and morbidity. Mortality means death. that's when you go see the pastor. I love to go to church and learn from them, but I don't want to be, talking about embalming for that's death. Mortality, morbidity is suffering. There is the potential to get COVID and to suffer over an extended period of time, even though you've passed the virus out of your system. So you're still on oxygen, you're still fatigued, your mind, your mentation is still not what it could be or what it should be. So you can be perfectly healthy, get it and die. You can be perfectly healthy, get it, and still not ever be as healthy as you were before you got this condition. And I've not seen that before. I've seen pneumonias come and go. I've seen urinary tract infections. I've seen people with congestive heart failure and heart attacks and strokes. But an infectious disease that affects you like this is devastating, and it affects every organ system. It is and not the perfect virus, but it is the perfect storm when it affects the body in that way. It's a great question.
Thank you, Dr. Lee. I appreciate that. Dr. Montgomery, can you get COVID-19 more than once?
Yeah, so there's no question that we are knowing that people are getting it. Not many people are getting it, but here's something to be very mindful of, right? We have a new virus that we've never seen before, and we don't know, just like the annual flu vaccine, are we going to continue to need to get annual boosters? What do we know? We know that people of antibodies, meaning you get the vaccine, you need a booster because your antibody levels, that protective level, is waning. So anytime you have an infection and your antibody level is high, and those antibody levels just by nature wane, you can get infected again, right? And so we just got to be mindful. This could very well be an annual indwelling, what we call an endemic disease, like the annual flu vaccine that we have to give to people every year. But Jocelyn, I also wanted to pivot us a little bit because of the complexity of this subject matter, but also because of what I've been hearing from our colleagues, right? And so I really want us to try to quickly move to asking the audience and being very keen on making sure we're answering their questions. Because never in my years, and again, I articulated my involvement in organized medicine and everything else in this city over decades, have I heard what I'm hearing from our colleagues in the funeral industry, in the church industry, in the medical industry, and then what I represent in our insurance industry, and then folks in the community. Never have I heard what I'm hearing. And so that tells me, wow, right? The level of concern to our community needs to be like, wait a minute, pause, stop, time out, no more questions, just go get your vaccine, and we'll pick up the questions later. But I mean, that's how frank it is to me. So let's get to their questions, Jocelyn. Let's really make sure the questions are not those that we wanted to hear and we were prepared for, but let's just go right to it. Because people that are listening, this is serious. When I listen to a pastor, mortician, and a church member pastor, and a doctor, and myself and others tell you about what we're seeing right now. And all due respect to my colleague, Dr. Lee, the perfect storm for me is this virus Delta variant with pandemic or an influenza flu coming along in the next several months, right? So we were always concerned last year when this pandemic first came out. Oh my God, perfect storm, flu and COVID, but everybody was, distancing and we were in lockdown. But what could happen now? And why am I even more so concerned? Because of the children. We know historically, decades, centuries, put a viral infection, a respiratory virus, into an environment with children, and it will spread like wildfire. So we really have our other public health colleagues who are down at the city school board arguing for what we're arguing for right here now with you all, passion and conviction, and we're pouring it out to you all. So let's get to what they want to know so that we can be very laser focused, so that at Mia's event on the 28th, we have an overwhelming number of people going and saying, this must be really real and time out, because the first variant, the first alpha COVID went after our most vulnerable, which was our elderly. This second virus, smarter than we are, always remember, viruses are smarter than we are. This second virus came along, a Delta variant, went after the next most vulnerable population, us adults, right? And it also infected people who were vaccinated. So that meant the virus got smart. So what's the third wave gonna do? We're already seeing Delta go after our children. We gotta be very mindful that a smart virus, if we don't get herd immunity, if we don't hurry up and vaccinate everyone, we have no idea what the next variant will be. At the same time, those of us who got vaccinated earlier are having to get boosters because our immunity is waning. So just wanted to direct us very targeted with my colleagues who are on the phone that we can really answer some good questions.
On that note, Dr. Montgomery, we do have a question that was posted that I'd like to direct to you. How does getting the vaccine affect current life insurance policies? I have heard that once administered, the life insurance is voided because some vaccines cause death.
Now, that's a good question for somebody that may not know, but I surely don't know the answer to that question, right? And so I would put you back to your benefits manager and the other folks that who can really help you. Reach out to your broker, reach out to your agent and ask them what is in those clauses, because that gets into contract law, right? Not necessarily what we're trying to address from that perspective, but really push that back to them from a contract law perspective.
Okay, another question, not necessarily for you, but from one of you on the panel. What can I share with senior citizens that do not trust the safety of the vaccine? Does the final approval for use by the FDA versus emergency use now mean that the vaccine has been proven to be safe? This is causing more confusion now. Anybody? Again, what can I share with senior citizens that do not trust the safety of the vaccination?
Well, and I'm going to jump in real quick, right? And then I'll let Dr. Lee jump in. One of the things that I like to tell my senior citizens and to be very mindful of, you all have the test of time when it comes to engaging with our healthcare system. What do I mean by that? For decades, we have been giving you medications, multiple medications, 8, 9. Some of you all can go into your room right now and find 8, 9, and 10 medications to prevent what? The impact of a chronic disease that nobody else is going to be impacted by. But what are we talking about now? A vaccine to prevent a killer disease impacting you. So I gotta always challenge us when people ask me, about safety and efficacy. And I said, I'm a family doc. You never asked me about that blood pressure medication. You never asked me about the insulin. You never asked me about the multiple things that were concerned and could impact you. Trust us right now, please. Get the vaccine. But Dr. Lee, I'll defer to you on that.
Dr. Lee, what can you share with senior citizens that do not trust the safety of the vaccine?
You got to share the truth. The truth of the matter is that the vaccine it has the potential to produce complications. And that's a real fact. I mean, and what Dr. Montgomery is saying is absolutely correct. We give patients insulin all the time. Insulin is an incredibly dangerous medicine. We give patients blood pressure medicines, beta blockers, and calcium, all these different things. These things have risk to them. That's the reality of it. But the risk of complications from COVID, we know that 2 to 5 people out of 1 million will have the most severe complication of COVID, which is anaphylaxis. And anaphylaxis is a big word to say you just can't breathe. Your respiratory system shuts down and your throat swells up and you choke and you can't breathe unless you have an EpiPen. It's possible, but it's incredibly unlikely. We know that 30% of the tests that have been done the last time I checked for COVID were positive. That means your chance of getting COVID is incredibly high. And if we know that 15% of the people over 75 will die from that infection. So if we look at the statistics, 2 to 5 out of 1 million versus the 15% who we know with severe or critical illness will likely have a severe complication, it pales in comparison. There's a lot of fear. There's a lot of ambiguity and urban myths and people, with data that's what we call anecdote. That is, you have armchair COVIDologists who have a theory about a thing, and I respect it. But the reality is that the data is on your side. We've been doing this since the hepatitis B. We've been doing this since polio. We've been doing this since, DT, diphtheria. All of that has been vaccination. Pneumonia, that's all vaccination. It's been effective, and we're perfect. It's not. And I can be honest with you that perfect is not, but it is our best solution to get out of this pandemic. And if we do what we've done in the past, and what I should say is when we do what we've done in the past with this pandemic, which is to fully vaccinate ourselves and take the other measures, we're going to get out of this thing. We're going to do other things. But I think it's a good question. It's a valid concern. But in the last thing I'm going to say is have that conversation with someone in addition to this forum. Talk to your primary care physician about it. Talk to your pastor about it. Sit down and have a real concern discussion about your concerns so that they can be addressed. Pray on it, bless it, do what you have to do. But the reality is that this works. It's a good strategy, and it's the right thing to do. And it will prevent severe illness in most instances, but it's not perfect.
Thank you. So can one of you expand on what the risk of contracting the virus is if someone is carrying the Delta variant, even though they've been vaccinated? Is it true that the vaccinated person will get a mild infection from the Delta variant?
You know, the statistics, if the question is what's the likelihood of contracting, what I mentioned earlier was that we know that most hospitalizations are from people who have been unvaccinated. Although vaccinated people do get hospitalized. So as I mentioned, a study that looked at over 100,000 patients, what they said that was 12 that were essentially vaccinated, or just patients in general that had been hospitalized because of COVID. They found that only 1,200 of those patients had not been actually had actually full vaccination. So that was 1%. So the likelihood of actually being hospitalized with, after having been vaccinated is incredibly low. It can happen, but it's incredibly low. But what's interesting is the one you're going to hear about that 1%. 80% of your discussion is going to be about that 1% and that exception. But that's the exception. It can happen, but it's not very common. And it's not very common to get severe illness or critical illness with the vaccination.
Thank you. Dr. Montgomery, a few minutes ago, you mentioned the flu vaccine, and there's a question: how quickly after your COVID vaccine can you get another vaccine such as flu or shingles?
I'm going to defer to Dr. Ali because I believe he's administering it right now, and there's some questions as to what that interval is, and it varies for different individuals, but I don't see long standing other than 2 to 4 weeks is typical. And Dr. Lee, are you guys sharing any additional or different information than that time frame?
Nothing different. It's 30 days. I would wait 30 days to give your body a chance to sort of adapt, adjust the immune system to ramp up. And I'm glad people are thinking like this. How many shots can I get? Because you're thinking what Dr. Montgomery said, which is, okay, COVID, pneumonia, flu, let me get myself thoroughly vaccinated so that I can get ready for this winter. And what we see is a peak within our community, but there's a tail. That I would say that in our zip codes, and when I say our, I'm actually saying the urban core 2, 4, 6, 8, and 9, most of those communities that where I practice at, that tail is going to go up and that tail is going to be longer. And because of that and it may go down faster in some other communities, but that tail is going to be longer, which means we're going to have to deal, even when you look at national data that says it's up and down, for us, it's going to be a longer tail, which means that we have to be that much more aggressive in getting appropriate vaccinations and doing what we need to do to protect ourselves.
Thank you. Pastor Walton or Dr. Hart, if one or both of you can answer this question, should Christians get the COVID-19 vaccine?
Oh, yes, definitely. I was preparing, I was looking at some notes, and the notes that I was looking at was back in September 27, 2015. Harmony was preparing then for these various things. And I have some seniors at church, but predominantly my church was a lot of young people that was in high school, they graduated, and they're all over the United States. And I was telling them at the beginning of this pandemic, be very careful until we get a vaccine. And they said, if they get a vaccine that quick, I said, no, y'all have to understand. I believe that this vaccine was in the work a while ago, that they just didn't just come up with it, but they had a foundation to build up on. Because in 1995, I was at a seminar at the University of Florida, and they were speaking of a lot of diseases that's come out since then, way back then. So they've been working on these various vaccines. I don't think they just came up with them overnight. And in speaking to my seniors, I would tell them that the heart, the brain, and the lungs are the tripart of life. If any of these organs fail to operate the way that God created it, life cannot exist in the body. And so I would tell them, God ordained medicine. And I tell them, do you take high blood pressure medicine? Yeah. Do you take an aspirin? Yes. Do you take various medications? Yeah. Well, then a vaccine is the same thing, because what it's going to do is it's going to teach your body to fight this disease for you. And you must take this vaccine because it's going to help you down the road.
Thank you,
I would
Pastor
agree.
Walton.
I would
Dr.
agree.
Hart?
I would agree with Pastor Walton wholeheartedly. I've heard it said that if you are in a battle, and my pastor actually said, if you're in a battle and you have bullets flying at you, and you have a bulletproof vest right there, are you just going to pray? Are you going to pick up the bulletproof vest, put it on, and pray? Everybody I think that's listening to me would say they would put the bulletproof vest on and pray. That's what the vaccine is. It's a bulletproof vest for what is going on. And I'm kind of disappointed at times when I hear different people, even pastors in the faith community, spread misinformation when it comes to these things. Because as a Christian, if we're speaking to people that believe in Jesus and all these things, it's just the right thing to do. It has to do with loving your neighbor as yourself. Maybe you feel like you're very healthy, you're not going to get it, but you could be asymptomatic and a carrier. So you're going to love your neighbor so that you don't spread it to them. Other things that I've said in regards to that, to people that believe God and are Christians, if you have fear, I heard Bishop T.D. Jakes say this as well. The COVID is a lot worse, and we know what happens with COVID than getting the vaccine, right? You could take it from point of it's the lesser, quote unquote, lesser of two evils, because we know what COVID does. We know the consequences of COVID, but we've had over, I don't know if I'm getting the stat correct, but over 130 million plus people in the United States take this vaccine and do fine. See, people don't think about that. They think about like what Dr. Lee was saying, the exceptions, and they bring up those exceptions, and it's plastered over social media that the vaccine is going to kill you and all these different things. And I've heard pastors say that. And it just hurts me to the core when they say that. But so you need to educate yourself. You need to use the wisdom that God gave you. You need to know that, as Pastor Walton said that the wisdom and the understanding that doctors have was given by God. So I believe that I prayed for this vaccine. I believe this vaccine is God's mercy and grace on humanity when it comes to having this really pandemic all around us. So really, it's just really, it's really thinking through and having an understanding of who you are in God and who you are in Christ. And do you want to really exemplify what the Word of God says? And part of that could be and should be getting the vaccine and getting vaccinated.
Thank you. And Ms. Hobdy, I'm not sure if you're still on the Zoom, but there is a question that perhaps you can answer, or any of our panelists, which asks, could any of the panelists provide information of what other initiatives are being considered to bring this message to the community in addition to this setting? Because there are people who are working and may not be able to join tonight. I'd like to first add, before I giving our panelists an opportunity to answer the question, and that is Ms. Hobdy mentioned at the beginning of the program that on Saturday, at the campus of Edward Waters University, there is going to be an event where folks can come out, not only pick up some groceries if your family needs it, but you can also get tested, or you can actually get the vaccine this Saturday again at Edward Waters College. I'd also like to mention to you that you should reference the Centers for Disease Control for information about COVID if you still have questions beyond tonight. I'd also like to invite you to like the Population Health Consortium of Northeast Florida on Facebook, as we often post information on that social media platform, in addition to the Partnership for Child Health's website, which offers some resources for you. And of course, you can always go on the Florida Department of Health's website to get information on events that are happening around town. And I'd like to read some more questions posted. And Let's see, we have several questions being posted, and my question has to do with the COVID booster and the flu vaccine. Is it safe to have the two close together? I think we've answered that question already. What are the long-term effects of the vaccine for young women who want to have children? Which one of you'd like to take that question? The long-term effects of the vaccine for young women who want to have children. Dr. Lee or Dr. Montgomery?
I'm very comfortable when answering the question, recognizing I don't know what ACOG's recent guidelines are. We've been seeing the emergence of this virus in pregnant women, and we know that they're developing complications. So I'm not yet certain that the data is out to tell us what those long-term complications are. What do we know about the long-term complications of COVID? My God, long hauler syndrome is just impacting people from the very beginning and has been. And so we know there's going to be some potentials, but I haven't seen ACOG and the Academy of Obstetrics and Gynecology who manage that. I don't know if Dr. Lee has seen that as yet. But I will tell you that if you all were looking at my face, you may have saw a smile because I was saying to myself, the preacher, the mortician, and the doctor all on the phone talking about something together and trying to get people to rally. Wow, that's different. And all my years, I've been doing this a long time. I don't think I've ever been on the line with the preacher, pastor, and a mortician all saying and a doctor saying we got to really focus on this. But Jocelyn, I apologize. I don't specifically know the answer to that question. I just know it's constant. I'm hearing every day about pregnant women having, being delivered early. I got several pregnant women in the hospital that I know of in terms of the work that I do. And yeah, they're pregnant, they're going to deliver early, and we're going to have problems, right? So Dr. Lee, if you can't answer, you may know a little bit more than I do.
I live in a similar space. I'm mostly family medicine, and so I don't have at my fingertips. That's something I can look up. And if there is a desire to get this information, we can find that information and send that to that person. And maybe I'll be able to find that before this call is over. I'll circle back on that. It's a great question, though.
Thank you, Dr. Lee. And one thing that Dr. Montgomery said earlier, or maybe I heard it in an earlier discussion today, is before this pandemic, people, if they had questions about medical issues, they would go to their family physician or their OBGYN or whomever is their medical doctor, and they would get questions answered. For some reason, people just don't seem to trust those folks. Get your answers from your medical providers. If you're not satisfied with the answer that you received, again, the Florida Department of Health is a resource. The Duval County Medical Society is a resource. The Northeast Florida Medical Society is a resource. The Northeast Florida Pediatric Society is a resource. All local resources that you can reach out to if you have any questions that were not answered tonight. But I would like to pose this next question or read the next question that was posted. If the vaccination is given and a person dies as a direct result of the vaccine, who is going to be held responsible? What about the family of the deceased? Some vaccines actually cause death. Are you all not concerned with the fact that they can cause death?
We are always concerned. I used to be the past secretary of the Florida Patient Safety Corporation, so very, very mindful of vaccine adverse event reporting system that's out there. We know that vaccines as medicine and everything, and to Dr. Lee's point, here's the difference. The vaccine causes death, if that be the case, and we know there's been reports of vaccine-associated deaths for every vaccine we've ever seen. Mm-hmm. But that vaccine causing death is only going to impact one person. That virus causing death is going to kill a whole lot of people. And folks, I can't get more real than this, right? That's the difference, okay? This is an infectious disease that's spreading by spreading, coughing, speaking, and the virus is changing. So you may die of that vaccine. You may die of any medication we give you, but that virus is going to kill and has killed more people than all our wars put together right now, right? We've all heard it. It's factual. And what's happening? We thought we were done with it. And what's happening? A Delta variant. What is it? Smarter than the first one. What do we expect as infectious disease and scientists, researchers? Common sense. The next one's coming along. It's just the natural history of viruses. So yes, we are very much concerned. We've been concerned about vaccines from day one, and we have a vaccine adverse event reporting system. If you have any side effects from a vaccine, you should report it. We know that there are common side effects. We know that people have bad complications of medications and clinical trials and everything we do in medicine. Go to the operating room and have a bad outcome. We know that happens. But this virus is not just impacting one person. It's impacting multiple people. It's being transmitted asymptomatically. We don't know who has it, and it's killing people, right? And so don't want us to not bring that. That's the reason I think we're here today, to bring this to a level of importance that just gets beyond anything else that we're thinking of when we say it's real talk, it's straight talk. We didn't want you to think everybody else telling you anything was any different than what you were hearing. We just wanted you to hear it from us as trusted people in your community, saying this is as real as it gets.
Thank you. And this question is for any of our panelists. And this was a hot discussion at the school board meeting today. Are you all in favor of mandatory mask and or vaccinations in schools, colleges, and work sites? Anybody can answer the question.
Jocelyn, I'd like to say that when I would teach my students, I would teach them about something called universal precaution. That's where you treat every case as if it's an infectious case. What I teach them is gloves, mask, a gown, having something to cover your hair and cover your shoes. This is the kit that they would need to protect themselves. Mask will protect people, and it will help slow it down, because as the doctor said, he didn't know, but he was speaking prophecy. When he says, we don't know what's going to come next, the good doctor was speaking prophecy. In 2 Timothy chapter 3, it speaks of in these last days, perilous times shall come. And that word time is described as decade. And if you don't believe it's true, just look at history. Just look from 1900 up to now, where each decade will present a new level of harm, hurt, and danger. And so, as he was saying, yeah, we don't know what's coming yet. We don't know, but I can guarantee you something is coming. It is coming, and we need to be prepared for it. So yes, there's no way that I would send anybody to school, especially in the public like this, without a mask. It's a no-brainer. It's a no-brainer.
Thank you, Pastor Walton. Dr. Hart, this question is being asked of you. From your perspective, should we be having church service with the masses?
I believe we can still have church services. We've been having them since December of last year, but your pastor and your church has to be on board with CDC protocols. Don't just go to church and have a super spreader event. You have to go to church with masks. You have to go to church being socially distanced and sanitizing your hands. Don't just take it as what we're doing as usual. You have to be on high alert. And this is just the times and the days that we're living in. Yes, when we didn't have a vaccine and we were still learning about this virus early on in the pandemic, yes, we all went online because we didn't know what was going on. But now we have a vaccine that we know works, just got FDA approved. We know that there's things that we can do to prevent the spread. I think it's irresponsible, and I think it's showing a lack of concern, a lack of love, and a lack of maturity when a faith leader will willingly have events and not even taking proper protocols. If you're unable to take the protocols, do the online event. So it's just, once again, going back to what we were saying, loving your neighbor as yourself when it comes to some of these things. I do want to speak to that question, Jocelyn, that you said around masks in schools. At our church, we have a school, 200 or so students. As a private school, and from the very beginning, we've been extremely strict on masks, strict on our protocols, taking temperatures at the door, all these different things. And even now, I'm on the chair of the school board, and we have a mask mandate that has not let up. I think, again, that's irresponsible for us to send our children into places, especially if they're 12 and under, where they are in close contact, not having at least the basic level of protection that we know that works. And I feel for those individuals that don't necessarily have the choice to send their child to a private school, possibly, and have to, as we even know they're having an emergency meeting today, have to send their child into an environment that they feel is unsafe. I think we're doing a disservice. We're having a disservice for our parents when we do things like that, because we don't know the children that are there that have illnesses and things, diabetes and just different things, that if they get sick, it's not going to be, you just isolate at home. It could be a hospital bed for them. And so we have to really love one another and think through these things before we just make these slap judgments based on political ideology or just personal emotion and things like that.
Dr. Hart, it's interesting that you said the word political, and this question isn't directed to you. It's actually directed to all of you. As someone asked, is the slowness in vaccinations related to former President Trump? And could that be a reason the African American community at large might be suspicious of the vaccine? Anyone like to take that?
Actually, Jocelyn, I'd like to, what we're dealing with is not just a physical problem or a mental problem. We're dealing with a spiritual problem, okay? It's a spiritual problem we're dealing with. Because I don't know if, like I say, I deal with prophecy. I look in this Bible for any answer or any question I have. I go to the Bible for it because I know the answer has to be in there. And in that chapter 3 of 2 Timothy, one of the things it says that's going to happen in the last days is that people will be disobedient to parents. And that comes out to be unpersuadable, that regardless of what you tell some people, they just won't believe it. They just will not believe it. And it says that another problem is going to be that men shall be lovers of themselves more so than lovers of God. And so we're dealing with a selfish, I am generation that only thinks about themselves. I even say that I even go as far as saying that the problems that's in Washington or the political problems is a reflection of the church, because church is so divided. No one is really concerned about really seeking and saving the lost, but everybody's concerned about their own individual place of worship, where the scripture tells us that one could put 1,000 to flight, two could put 10,000 to flight. That if we come together and realize that we all are just a body part of the body of Christ, that we can accomplish great things. Pastor David said, put on your vest as well as pray. Well, I believe that if we truly begin to pray about this thing, that we can change things, because government was ordained by God. I tell people, when Trump was elected president, talk to the Lord about that, because why he allowed him to be president, ask the Lord why, because that is ordained by God. We have to ask ourselves, the Lord, why did you see fit to allow him to be president? Why do you see fit for Biden to be the president? Why do you see fit for the governor that we have to be our governor? It's ordained by God. And this is one thing that I do know. Every pastor, everybody who's in a political position, they're going to have to give an account to God on the day of judgment for how they carried out their calling and fulfilled their duties, because a God we here to serve the present age, our calling to fulfill. Oh, may all our powers engage to do our master's will. It's a spiritual problem, not just a physical or mental problem. This is a spiritual problem. And when the church gets together, I think we'll see a big change in everything from Washington all the way down.
So Pastor Walton, I'd like to follow up with a question. What do you say to people who say I'm covered by the blood and don't need the vaccine?
I tell them like this. When they diagnosed me with stage 4 cancer, okay, it metastasized to my brain, from my lung to my brain. That was last August. Well, right now, this is what I went through. I prayed and I allowed them to give me radiation. I went through 5 days, intense radiation. I've got the mask over there. I keep that mask because I show people what I went through. And not only that, but they give me Keytruda. I go it was every 3 weeks, but they're stepping me down on it because the tumors, the lesions are shrinking. The last MRI I had, it says that it's autofactual, which means that the MRI machine thinks that it was a glitch, that it's no longer there. And I tell people, yes, God healed. I know in the blood of Jesus. I believe in that by his stripes, I'm healed. I understand that. But God has given us the ability, given man the ability to be able to take care of some things. Now, if I had just gone off of faith, understand, I'm not lacking faith. If I had just gone off of, I'm believing God. I'm just believing God for my healing, and did not receive the medication or the treatment that God has given me, they would have been singing, "Near, oh my God, to thee." There are people that started out the same way that I did that's no longer here. And why God saw fit to keep me here, I guess for this moment here right now, to testify that he is a healer. And sometimes you have to take what God has given you. I mean, this medicine that they have out now, there is no way man could have come up with these ideas, even if they don't acknowledge God, even if they don't give God the credit for coming up with the medication that's given. It doesn't change the fact that he gave them the mind and the will to be able to do that, to come up with things that can heal people. And I tell them, "I'll know, get the vaccine. I'm covered in the blood. I'm washed in his blood. I'm healed by his stripes." And I took that medicine. And I tell you, thank the Lord for it.
Pastor Walter, you gave an analogy the other night, and it's something that we've shared before about the person and the boat, the things that, can you say that again real quick, please?
Yes, there was a dam, and the dam overflowed and it broke, and the water began to come out and it began to flood in this town. And so as the water was coming up, somebody came by in a rowboat, a canoe, a rowboat. And he told the man in the house, he said, "Get in the boat." The man said, "No, I'm waiting on the Lord." The water got a little higher. And they said, man came by, he was in a motorboat. And he pulled up and he said, "Come on, get in the boat. Let me take you to safety." The man said, "No, I'm waiting on the Lord." And then the water got up so high that it covered the rooftop, and the man climbed up to the top of his house, and the helicopter came over and dropped down a hoist and said, grab on, let me take you to safety." The man said, "No, I'm waiting on the Lord." And after a while, the water came up, the man drowned, and he got to heaven. And he said, "Lord, I was waiting on you." And the Lord said, "I sent 2 boats and a helicopter." And we've got to understand the mask, the vaccine, the sanitizer. Those are the boats and the helicopter that God said, "Take what I have given you, that you can be healed, that you can be whole." And that's what we need to do as people. We need to understand that God has given us some things. You know, why do we eat the food that we eat? Why do we do the things that we do? It's because God has given it to us. And I tell you what, and for those who say, "I don't want to wear a mask," I tell you what, if you own a gun, put your gun away, okay? Use that same faith that you use for the mask to protect your house. You know, use that same faith that you use, for everything else. And I tell you, when we sit down and really think about it, it doesn't make sense, the arguments that we give.
Right. I gotta chime in because I'm laughing. I'm like, and along those same lines, right? An ounce of prevention. That's what we're asking. Because you are guaranteed going to trust anyone at any one of these local hospitals to take care of you when you get there with this disease. And what do we know they're going to do? We know we're going to stick a needle in your arm. We're going to do all kinds of different things, x-rays and tubes. And if we got to intubate you, you are trusting us. You're trusting us. Trust us to prevent you from having to come to the emergency room in the first place. And what we're saying at this point, we know for sure, Dr. Lee and others, and from the beginning of my talking about this back in February, the vaccine is to protect against hospitalization and death. And if you get that vaccine, that's covered. You are protected pretty much against hospitalization and death. And that's something that made me just remind myself. You're going to trust us on the back end when you come in the rescue, and we're trying to take care of you. And I've been in those environments trying to do all I can. Please let us help us, right? And that's what healthcare providers are saying, hospital system, help us. We're gonna do whatever we can when you get into this door. You walk into Dr. Lee's office and all my other colleagues, they are gonna do everything you can. The preachers are gonna pray for you, but boy, if you get the vaccine, the likelihood is you're not gonna have to see the mortician, right? And that's what we're focusing on.
So Dr. Lee, I have one question. Can the panelists advise, or can you advise to the safety of having senior citizens age 60 and over taking part in indoor activities?
You know, that's a really, I'll tell you what my daughter tells me, and I got four of them, and my son less so. It depends. You know, it really depends. We're in the middle of the pandemic. We're in a spike. We have Delta variant. Would I advise it? To be frank with you, probably not. It depends on whether they're vaccinated, depends on how big it is, what kind of air filtration system you have. It really a blanket. And I think what we're trying to do is avoid doing what we did before. But the reality is that the numbers are worse than they were before. And some of the precautions that we took, because I didn't like the isolation. I like being around people and talk. I didn't know that I liked it as much as I did until I couldn't do it. But then when I could do it, I was so excited to talk to people. But the reality is that we should be thinking in terms of we should be obeying those principles, which is social distancing. We should be wearing masks. We should avoid congregation outside of, absolutely necessary stuff when possible. So my recommendation, if I'm honest with you, if you ask me, is to say no. I would hold off on that. The Zoom is a beautiful thing, or whatever platform you think is the right thing to kind of come together and to interact. I am deeply concerned about the seniors and their level of isolation, but finding other ways to pull together, to be creative. I would say that they've done it here at Shell Suite, keeping people engaged and involved. I've seen a lot of mortality come from people being alone. And so I don't want that, but I still don't think we're at a point where we can just hang out just to hang out. Because it puts us at risk, especially when we're spiking this high, and this Delta variant is a beast. And a lot of what we have to protect ourselves is still, and there are other variants. We're saying Delta, but there's Epsilon, there's Lambda, there's Beta. The virus is doing what the virus does, as Dr. Montgomery describes it, as a smart virus. So that's the one thing. The second thing, and this is a pivot on that question, I don't see the bravado in patients that I hear them say. There's a carefree bravado that I hear people talk about. Well, I won't get it, and this is this. When I say patients who come in to see me after they've been sick, they're quiet. There's a peacefulness about them. There's a humility in their voice, in their eyes. There's a seriousness about the interaction. And that virus almost got me. It was almost like they looked into the gates of wherever the beyond, and they were almost heading down that direction. And they are grateful that they, in fact, did not have that transition. So a lot of this is bravado that does not carry over when praise the Lord, but pass the ammunition. It is, here we are in this conversation about this thing. And Dr. Hart mentioned this. It's very theoretical. But when you're sitting there intubated, and Dr. Montgomery said it, you can't trust us to give you the vaccine, but you're going to trust us to give us your remdesivir and dexamethasone. It just seems to me very interesting, and there's there's some interesting pieces. So I very much, I know I kind of pivoted on this, but I kind of thought about that as it's important to be humble by this. And the last piece is Churchill. Churchill said that Americans will always do the right thing after they've exhausted all other possibilities. I do very much get the sense that we're going to vaccinate ourselves out of this. We're going to socially, not isolate, but distance ourselves. We're going to cover ourselves. We're going to do what we need to do to get this thing handled ultimately. And I think it's forums like this that make that possible. So thank you.
And Dr. Lee, there was another part of that question and regarding seniors and indoor activities. The other part of that question is if they are fully vaccinated and that they wear a mask. Is it okay for them to participate in indoor activities?
I'm gonna let Dr. Montgomery, he wants to, I can see that look on his face.
Because I think there's a level of comfort, right, that we always have to have whenever we as physicians tell individuals, when you get a flu vaccine, we feel a level of comfort with the flu, right? So we've got the flu vaccine. And so even with this vaccine, we should, as we did, feel a level of comfort when you are vaccinated and socially distanced and wearing a mask. That's just basic. What we know is that people are not telling us the truth about whether or not they've been vaccinated. And we don't know what is going to be like when people need to get that second vaccine. So if you're honest and you've not been vaccinated, you got a different risk profile. And because these strategies, and even CDC came out, I think it was an article in JAMA that was just out recently about these risk avoidance strategies, that we got to basically have risk-based strategies, right? What's your risk? And when you look at it from the perspective of what's your risk, I think people will come to grips with a lot of questions, a lot of answers.
So Dr. Montgomery, I'm going to ask you this question. What is monoclonal antibodies and why is it not being talked about as a treatment?
Well, I'm going to defer to Dr. Lee because he's seeing patients, but it is available and referenced as a treatment. And we're going to know that there are going to be a whole lot of treatments coming up. But what we're focusing on is not treatment, right? Because you're going to trust us to treat you. We want to really focus on stopping the spread of this infectious disease. That's big, folks. There's a big difference. We treat disease all the time. But the focus, please narrow the focus to treating and preventing the spread of this highly infectious disease that's killing our community. Dr. Lee, you want to tell them more about, if I've not even used it, I don't know if you using it or recommending it to anyone right now, but we're here.
I've not used it, and I've read about it. And what I do know is that it's a therapy that is essentially antibodies that is specifically targeted for people with specific risk profiles that are at risk for severe complications of COVID. And so it's a way to treat, or that you've had an exposure and you have that risk profile, and it makes sense to treat you with this therapy. Essentially what it is it's antibodies that attack the part of COVID called the spike protein that actually will protect your body from getting the COVID infection. I think the Regeneron, all the stuff that you're seeing in the news that's the monoclonal antibody itself being used to impact disease for patients. And the evidence suggests that it is an effective method of treatment, regardless of what's around it. I think that the evidence is pretty solid in that respect. And there's some challenges as it begins to mutate, and so that piece will change as well. So that's what I know. I've not had a chance to use it. I do recommend it if you're within that population of patients who would benefit from it. I think it is an effective method of treatment.
And so that gets back to another point, right? Because it's treatment versus prevention, right? And so what we're saying is the antibodies monoclonal for treatment is similar, but what are we giving you with the vaccine? We want you to develop antibodies to prevent you from getting the disease, right? So antibodies to prevent the disease or antibodies to treat the disease? I think, again, it gets back to Pastor Walton. It's a no-brainer. Give me the antibodies. Help me develop the antibodies to prevent the disease. If I get the disease, you're going to trust the doctors to do the right thing. So that's off the plate. When you get the disease, we're going to do what we need to do according to guidelines. That's off the plate. What's on the plate is you making that step to get vaccinated, to protect you and your family and your loved ones and your community against this killer disease right now. That's important. And the more people we get vaccinated, the less likelihood that another variant will come along and beat us up. It's called herd immunity. Could we have avoided this? Some of us would say in the infectious disease community, if we would have gotten enough people vaccinated the first time around, we might have prevented this Delta variant. So let's vaccinate the second time around so we can prevent the third one. And if we miss it on the third one, please, 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 let's make sure we all buckle down on the fourth time around, because it's going to be really bad, right?
And on that note, thank you, Dr. Montgomery. And for those of you who did not hear at the beginning, tonight we were gracious to have Dr. John Montgomery with Humana, Dr. Kenyatta Lee, representing the Northeast Florida Medical Society and Pareto Population Health Management Practice, Dr. Andrea Hart, representing the Agape Life Solutions, and I'll just say Impact Church, even though she didn't ask me to give that plug, and Pastor Tony Walton, Harmony Church of Jacksonville, licensed funeral director and restorative artist. I'd like to thank our sponsors, Humana, the Partnership for Child Health, Population Health Consortium of Northeast Florida, Edward Waters University, and I can't remember who else. I think I summed it up at the beginning of the program. Mia Habdi with Edward Waters University gave you a nugget regarding an upcoming activity, and she will now come to you with closing remarks. Again, I am Jocelyn Turner with the Partnership for Child Health. Thank you all. And Dr. Montgomery is burning to say one more thing, but before he does, I'd like to add my commentary. If you didn't hear anything tonight, I hope you heard the impassioned plea of all of our speakers in that please trust trusted sources for information as you need more answers about COVID-19 vaccine and the virus. But I think you heard from all of them in what they shared. The commonality is please get vaccinated. Dr. Montgomery.
Yeah, I just want to say, folks, we had a quarterback, and it's not Jocelyn, but thank you, Jocelyn. It was somebody by the name of Katie Fleetwood Ames. And Katie, we all owe you a big, big thank you. Get better. Thank you very much. We appreciate all that you did to bring us all together. This wouldn't have happened, folks, without Katie. I really want to say that. So thank you very much.
Thank you. You're absolutely right. Katie Ames with Humana and Elizabeth Perry also. We had a great team putting this together. And for those of you who did not get your questions answered tonight, please forgive us. We tried to get to most of them, and also like to acknowledge Dr. Lorene Husband with Feeding Northeast Florida, because to be quite frankly, she's the one that brought me to the table, and they have been doing a magnificent job of making sure that folks who were not able to provide for their families as far as food is concerned, Feeding Northeast Florida has been making sure folks are being fed. So thank you, Dr. Husband, and thank you, Feeding Northeast Florida. Ms. Habdi, the floor is yours.
I do want to say one thing before I also thank everyone. Toya Walker, I saw your question about if any one of us have received the COVID shot and how we, what kind of symptoms we may have had afterwards. Well, I want to just say that I'm fully vaccinated, and I was prepared. I was prepared for, some of the symptoms that I had read about, and those symptoms are supposed to, from everything that I've read, indicate that it's working, right? So I was prepared to feel, fatigue, maybe not feel so well. And, I decided I would do it, just prior to a weekend so I could really rest. I didn't have any, I had no symptoms whatsoever, Toya. And I can say that I'm so thankful that the vaccine is available. And I'm continuing to wear my mask. I've never stopped, and I will not stop, but I'm thankful to have the vaccine. And I just wanted to address that directly to you because, and I'm sure there are others who on the panel who are vaccinated. I imagine probably all. But I just wanted to say that my arm didn't even hurt. I was expecting, from everything I read, for my arm to feel like wanted to fall off, but it didn't. So anyway, thank you all so much. As everyone has stated, this has been, a great opportunity, and I'm thankful for everyone who's participated and helped. And I just want to remind everyone to share with your family and friends to come on out on Saturday, August 28th, Edward Waters University at 1401 Grunthal Street, where we will have testing and COVID shots available, as well as we're always addressing food security in conjunction with Feeding Northeast Florida. So please come out and, you know, get those COVID shots and test if you need to. We'll be there waiting for you. Thank you so much. Thanks,
What time, what time?
Yeah, sorry about that. Yes, we will be there from 9 to 12.
Thank you, Ms. Hobley. And that concludes this evening's presentation. Again, please consult with your medical provider, the health department, or other trusted sources for information as you are dispelling myths within your circle of influence. Thank you, and that concludes this program. Good evening.